we've spoken about MDG 5, where we need to actually decrease child mortality. So now, most of the time, we find that those mortalities are from malnutrition, things like malnutrition, things that are preventable. Because the last report that we had was for 2010, we're not doing very well. So now the department has to come with strategies. We need to look into saying, let us go now, because these children are dying. So it means we need to, like, we are talking about re-engineering the PHC. Health is looking at saying, at focusing more on preventative, yes, than on managing children, people in hospitals. So there is PHC engineering that includes the very same thing, that going to the people with preventative things. It is informed by the fact that we are not doing well, we mid-term assessment or results, then we had to come with strategies. World Vision is a close NGO, and we are partnering with on almost most of the things that we are doing in the test in connection with World Baby. Launched this area with eHealth, World Vision. So they sponsored us with all the material that is needed for to function, like scales, work tapes, and these boards here, these arrangements. And if you know what growth talks to the height and weight, it goes together. So for a child to say to identify my standard, you must be able to use this. This was also donated by World Vision. Here we're saying they're also looking at teaching mothers about preparation of sugar salt solution at home. They sponsored us with the set like sugar salt, a cup, a jug, and kettles to boil water and everything, and also here with the stationery.
The war rooms and the Philamntwana centers help government and their partners, including World Vision, to address the Millennium Development Goal number 4 to reduce child mortality. And what I think is so brilliant, it exactly aligns to the Child Health Now program of World Vision, of wanting to reduce child mortality, under 5 child mortality.
La sihlepheka kakhulu uma ukuthi kufanele uhambise umntwana ekliniki awukwazi ukumhambisa if imali ungenayo, kodwa uma ingekho imali isekudeni ekliniki ngeke ukwazi ukuthi ungahamba nangenyawo, kufanele uzothole kuqala imali ukuze ukwazi umhambisa ekliniki. If ikliniki ngoba naku seyikhona la sesiyakwazi ukusizakala. La bayasifundisa ukuthi umntwana unceliswa kanjani, uma umupha ukudla umupha kanjani, nokunye ke nje ukuthi umntwana masekhulile sekwazi ukuhamba senenyanga senelokujane u6 months uqala umupha ukudla kanjani.
At a center like this, children are monitored for growth through weighing and MWAP, and also they are given vitamin A every 6 months. They're checked. CCGs are not giving, like you said, they are preventive and promoting. They are not giving, they don't have treatment, but then they are also like screening children for things like TB. Every child that comes here should be screened for TB as well, through asking the 6 questions. They've got desk aids that helps them to actually ask the mothers to screen for TB. They are also like screening children, they've got to deworming. Our children are supposed to get to deworming and vitamin A every 6 months until they reach 5 years. So here they actually screening. They're also now there. It's mostly to give education on preventative things, like on how to prevent malnutrition, on family planning to women, on feeding, on feeding of babies.
I think the Philamntwana centers are addressing the gap, because now child health is being owned by the Department of Health, and we are facilitators to help with resources to make it, to fast track the implementation of it. But it's their vision, we've aligned to their vision, it aligns with World Vision's Child Health Now campaign, and we're only adding a few resources and coming alongside to implement it and to help them with the gaps as they go forward. But when World Vision is gone, I think there will be a sustainable, amazing project on the ground. The Value-Based Life Skills program is one of the, I think, the interventions that are adding greatest value into the lives of children. The challenges young people face are peer pressure, are lots of negative statements in the household, because the households are struggling in poverty. And As human beings, we tend to receive the negative more than the positive. So this program helps them to erase the negative and feed on the positive and move beyond the constraints of their home environment.
Into ngiyifundile ka-value-based life skill, ngifunda ukuthi sithembe, ungalaleli abantu, ube neqiniso. Nokuthi uma wenza into uqala ucabange kuqala.
Kusho ukuthi iprogram yaka-World Vision u-value-based life skills ungisize kakhulu, especially ezintweni ekade zingihlupha emphefumulweni. And futhi izinto eziningi ngigwemekile kuzo njengentombazane, eziningi ezinye izinto amantombazane ezidlula kuzo isikhathi singakafiki. Ngasho ngithi ungikhulisile ngempela ngokomqondo, mentally. Futhi ngaloko I will always be grateful. Ama-topic akhona angibusisi vele engawathanda yile ethi I am special and unique. Abantu banako ukukhesana nokuchaphana, mhlawumbe mina-ke bajwayele ungichapha ngokuthi ngimfisha, kodwa-ke bona bakwenza ukuthi ngi-understande ukuthi ngoba ngimfisha nje ingoba uNkulunkulu wayethanda ukuthi ngibe mfisha, hhayi ukuthi ngoba nami mhlawumbe ngakhethela lo ukuthi ku-wrong ukuthi ngibe mfisha.
As teenagers, ziningi izinto esibhekana nazo ezingama-challenges. Thothi kwesinye isikhathi uma thothi uyakhola uhlangane lama-challenges bakubize names. Thothi uma ngabe uqala ukukhula, you care more about your looks, ukuthi ubukeka kanjani, ufuna ukwazi ukuthi abantu bacabanga ukuthini ngawe. Bona bayasitshengisa ukuthi we shouldn't mind ukuthi abantu abathini ngathi. Thina all we should care about is what God thinks about us, because uNkulunkulu akazi acabanga ukubi ngawe. God is always positive about us.
Ekubhemeni kwami ngithe uma ngikhula bebesho ukuthi ubhema kuyinkinga kanjani, because nethalente mina bengingaboni ukuthi ithalente lokucula kunalo. Ngibona abazi bangivezela ukuthi kahle kahle ngiphiwe ngasebuculeni.
First, we deal with the children, and then we look for leadership potential, and those that have leadership potential are then trained to become peer educators of the rest of the youth. And with the leaders, we give more input into them.
Manje nje singakwazi ukuthi nami ngene phambi kwabantu ngikhulume nje bengumuntu onamahloni ngalendlela eyisimanga. Ngibona nje impilo yami iphumelele. Ngibona ngingakwazi ukufeza into eningi futhi ngiyibona konke la abasebekushila bangitshela bona. Ngibona ngiwomunye ozobajabulisa.
And one leader said, even with all the input that I got, I fell pregnant and I had a child, and I wanted to end my association with this program because I felt I embarrassed. I was an embarrassment to myself, to my family, and to this program. And they came and they said to me, no, we all make mistakes. Learn from your mistakes and take your life story into the lives of other young people and say, even when you make a mistake, there is a future for you.
Ngihambe endleleni ezimbi, ngasheshe ngathola ingane, ngabandakanya kwezocansi ngisasemncane ngakashadi. Konke sasikufundile, bathi singaye ecansini sasebancane, kodwa zangilalele, ngakhetha ukulalela umuntu engangizwana naye. Mina ngithwale kanzima ngokuthola ingane ngisasemncane, kwakhosta ukuthi ngeke isikole.
This program actually erases the negative of the past and gives people the understanding, and young people the understanding, that God loves them and they can do anything if they with the resources they have inside of them, and then take on the world.
Kumanje sengihamba ngendlela yabahle, ngihlukene nakho konke, angisajoli, ngiyafunda esikoleni ngiyaphasa impela kahle.
These young people are adding back into the community to other young kids and helping them transform their lives.
Kubangani bami nabantu abasengangami abayintsha, ngithi bangalenzi ucansi bangashadi, noma ungalenzi icansi ungathatha isinqumo, ngoba ukumitha kunzima, and nobuzima nje sengahlangabezana nabo. Ngibuka abantu emphakathini, isesikoleni, ngibona abantu engathi bubuke mina nesisesikhulu, bangithuke abangithukayo, ngithi nabangalinge nje baze babandakanya
kwezocansi